After your prep, just like the direct method, you measure the size of the OVC that you need. Then you use the replica to make sure you've chosen the right size and to make sure that you've got enough room by getting the patient to bite together. Once you've got enough clearance, then you place the new McDonald matrix. Sometimes it helps just to shape it a little bit. It is pre-shaped for whatever tooth you're using. Often I put it down one side and then roll it over. And what can help is just putting the wedges in place just to hold it into position. You can often do one end first and put a wedge in, and that stabilizes it, and then do the other side just like this. Then just tighten the matrix with the screwdriver. You can, if you want to, for stability, use tweezers or pliers just to hold the toggle. I like to burnish the area, just make sure that the matrix is right up against the adjacent teeth, and give the wedges a good push in. So after the ball burnishing, then I put the separator in. The rubber sep is an excellent one I've found. It's very good at making like a little thin skin in there for separating. So I make it go right up the walls of the matrix and even over onto the surface of the teeth either side. Then air dry it, and then you can go ahead and put your OVC in. So take it off the lid there, and then just pop it out and then squish it straight inside the matrix band. So just line it up for the right height. I often use my flat plastic to line it up with the adjacent marginal ridges. And then with the very fine carving instrument, I tend to tidy away the excess there, especially around the lingual first, because then I quite often will go and just light cure the lingual side, as shown here. And then I can go straight ahead and clean up the buccal side. I can loosen off the matrix band a little and then go in and tidy up the buccal. I don't always do this. Sometimes I will just, especially on difficult patients, I'll just go in and light cure the whole thing and then do all the tidy up outside the mouth. But if I've got a good patient, I'll often spend a little bit more time in the mouth. Then fully light cure. And then I'll take the wedges out, and often once I've taken the wedges out, often I can just peel the matrix band and the OVC off all in one. But here we're showing actually taking the matrix band off first and then taking the OVC off. As I say, often I can just flick that OVC off and the matrix band and the OVC off will come out in one piece, which is much quicker and easier. You can give it a little bit more light cure too if you feel necessary. And pop it off, and I would light cure that outside the mouth as well. I'll turn it upside down and I'd actually light cure quite strongly on the intaglio surface, and I'd put the light right up against it because it'll actually heat this material up. And this is a lab grade material which actually responds to heat as well as the light. Then just remove the skin of the separating agent. I will also be getting rid of it before I bond with a micro etcher, or you can use just some pure pumice and water, or even just a touch with a bull burr at the high speed. So now I'm just polishing up the excess. Just remove that excess there, just get those embrasures nice, get it nice and smooth so it looks like a lab one. And now I would just add, just check my contacts. Usually they'll be a little bit loose because of the thickness of the matrix band. So I'm just going to tighten the contacts up just by putting a little bit of bond. And then we're all ready just to bond it in, just like a lab onlay using dual cure resin cement.